Hi everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, how does nerve stimulation affect immunity? And this one is a really interesting question because we have a very new and upcoming field of neuroimmunology. It is a very hot topic of late, and basically how the nervous system and the immune system are interconnected, interrelated, and how one system can affect the other greatly. And so with regards to the nervous system can control the immune system in a variety of ways, whether it's direct stimulation to organs that work with the immune system, like the spleen, the thymus, and other areas like that, bone marrow, which are where immune cells are made. It can also have direct stimulation to immune cells. And so basically it can release neurotransmitters that then bind to immune cells, and then those immune cells can then have a specific output, whether that's increasing specific cytokine release, which are these little chemical messengers that how the immune system communicates with other cells, or it can be to stop signaling, stop movement, or stop producing more cells. So I want to get into a paper talking about how then peripheral nerve stimulation can affect immunity. And so if we look at this paper here, it is from the International Immunology from 2021. It is called Peripheral Nerve Stimulation and Immunity, the Expanding Opportunities and Providing Mechanistic Insight and Therapeutic Intervention. All right, so the reason why I like this paper is because it has just a lot of good graphics that are very detailed, and so we can just discuss them. But if we look at the abstract, is basically talking about how there's a symbiotic relationship. Let's go back a little bit. Basically, there's preclinical evidence showing that vagus nerve stimulation, the vagus nerve, which is the wandering nerve that comes from your brain all the way down into your abdomen, on how modulating that, regulating that, or how that regulates immunity. Clinical trials have utilized vagus nerve stimulation in the treatment of patients with inflammatory disorders. So the symbiotic relationship between preclinical and clinical research exploring vagus nerve-based inflammatory reflex has been substantially contributed to establishing field of bioelectronic medicine. Okay, so there's crosstalk between the vagus nerve and other neural circuitries that control inflammation. Again, other neural circuitries. So there's multiple neural circuitries, not just the vagus nerve, that helps control inflammation. And so how can we delineate, how can we find new neural immunoregulatory pathways? So they look at the role of vagus nerve and non-vagus nerve related pathways to neuroimmune communication and inflammatory regulation. So let's get right into it. The inflammatory reflex that they keep talking about, just is about how if there's inflammation in the gut or inflammation in some part of the body, that is sensed through the vagus nerve up to the brain, and the brain then sends signals down through the vagus nerve to decrease the inflammation. It's called the cholinergic anti-inflammatory pathway that does that. Okay, so let's start with this picture right here. So if we look down at the bottom, it just talks about the vagus nerve mediated reflex circuitry in immunity and inflammation, and this inflammatory reflex that I was just talking about. So if you have, let's say, the sciatic nerve, which brings in neural connections from the leg, that in the blue can come up the spinal cord, and it can go up here, and it can activate the regions of the brain involved in the vagus nerve, the main regions in the medulla of the brainstem, the neural tractus halluteris, and the dorsal motor nucleus of the vagus nerve. Okay, so therefore, we know that just not even looking at the vagus nerve, we have a sciatic nerve that can do this. What's not depicted here is the trigeminal nerve, which is on the face. That is going to also activate many areas in the brainstem, including the vagus nerve in this vagus nerve circuitry. And so therefore vagus nerve stimulation has been shown to decrease brain inflammation. Also points on, so this is actually an acupuncture point. But points on the hand can affect this as well. And then the output. So, well, let's talk about the afferent vagus nerve. So the afferent vagus nerve, which is the sensory vagus nerve, also will sense pro-inflammatory cytokines. They'll go up the vagus nerve to tell the brain what's going on. And then again, there's this communication from the brainstem to the rest of the brain coming back down. The dorsal motor vagus nerve comes down. This efferent vagus, or the motor vagus, basically the output, is going to go down and connect to many areas that can affect inflammation, including the adrenal gland. And the adrenal gland can therefore increase dopamine, which is going to help decrease inflammation and decrease mortality from sepsis. It can also go to the celiac plexus, which is just a bundle of nerve cell bodies that are in the gut, and then they connect through the splenic nerve to the spleen, and therefore can be direct activation or direct control over the spleen to decrease pro-inflammatory cytokines, therefore inhibit tissue injury from excessive inflammation. So that is the main inflammatory reflex there. I just like that in clearing. Okay, so vagus nerve stimulation basically can do a lot of things. There's been over 20 years of publication of vagus nerve stimulation. But what I want to talk about here is just that cholinergic anti-inflammatory pathway is this non-invasive transcutaneous auricular vagus nerve stimulation has been increasingly used. So basically stimulating the vagus nerve through the ear on the auricular branch. Things like the gamma cord device that stimulate the vagus nerve directly on the nerve in the neck has also been shown to decrease or improve anti-inflammatory outcomes, alleviate inflammation in people with rheumatoid arthritis. But then they talk about this near organ stimulation. So they're looking at other ways to stimulate, rather than stimulate the vagus nerve, how can we stimulate this near organ? So people that have maybe really bad outcomes where they can have surgical intervention, we can maybe stimulate directly at the liver, or obviously stimulating at the neck. We know that there's anti-inflammatory benefits of stimulating at the neck. Stimulating directly at the heart, stimulating the splenic nerve going to the spleen. And so this is just other areas that have been shown to have benefits on these different conditions. Endotoxemia, so basically blood inflammation, arthritis, post-operative ileus, so a problem with the small intestine after post-op, inflammatory bowel disease, and hepatitis or liver inflammation. Vagus nerve stimulation can affect all of them as well. And then lastly, they talk about stimulating directly on the carotid body. So this is the main artery, the internal carotid artery coming up that goes to supply the brain. Okay, and the external carotid also goes to supply the face. This carotid body is what's sensing blood pressure, and so basically if it's not sensing enough blood pressure, then the brain assumes that it's not getting good blood flow to the head, and therefore it's going to increase blood pressure. So stimulating this nerve has also been shown to have, or stimulating this carotid body, which goes up the vagus nerve, has been shown to also improve inflammatory outcomes through different areas. So actually connecting to the endocrine system. So the neuroendocrine system, the endocrine system deals with hormones. And so affecting cortisol. So the adrenal glands are going to increase cortisol output. And by increasing cortisol output, that can actually decrease inflammation. Of course, we don't want cortisol output to be happening constantly. Cortisol, cortisone, or corticosterone, both of those are going to decrease inflammation, but if we have too much decreased inflammation, that actually leads to a chronic state of the immune system producing more inflammation. And so in acute periods, cortisol is good to decrease inflammation. And so that's where carotid body stimulation might be beneficial to affect the immune system as well. So if we bring it back in, we know there are multiple areas in the brain that control the immune system, affect the immune system. The vagus nerve is one of them, but there are other areas that do affect inflammation and do affect immunity. And so therefore, you can stimulate other areas on the brain, or other peripheral nerves, whether that be the sciatic nerve in the leg, whether that be the median nerve on the hand, whether it be the trigeminal nerve in the face, and you can affect those brain areas to then have better control over immunity. And so it really just kind of depends which one is best for you, best one is best for the individual. That's where a good, thorough exam and assessment can take place to then find out which ones would be the best. Generally, anybody can benefit from vagus nerve stimulation because it can not only help enhance immunity, but it helps to improve that parasympathetic rest and digest nervous system. So if you have any questions or comments, I'd love to hear them. If you have any suggestions for future topics, please leave them below. Otherwise, just have a great day and stay healthy.